recording.
I'm mocking him.
Dr. El Ashtari, how are you?
I'm good. How are you?
I'm Dr. John Delatorre, and this is the Texas Psychologist. I'm doing well. So here we are at the start of the 2025 TPA convention.
Yes.
How many conventions have you attended previously?
In my entire career?
In your entire career?
I don't know. 5, 6 maybe? Not that many. So you may want to cut that. I'm new to TPA-ish, relatively.
I mean, 5 or 6. I mean, has that been 5 or 6 straight years, or kind of intermittent?
Oh, straight? I'd say 5.
Or forward, right? Forward, not straight?
That's right. Always forward, never straight. 5 years of probably consecutive attendance.
What drives the motivation for you to attend conventions?
That's a good question. I love the conference because, one, you get to do ongoing learning, get to learn from Texas colleagues. Some of our presenters are also not from Texas, which is really cool too. I enjoy the social aspect of it too, because I get to see psychologists that I know and I've established relationships with that don't live in Houston where I am. So I don't really get the opportunities to connect with them or engage in consultation. And I really enjoy the network of Texas psychologists, and both personally, interpersonally, but also they have a wealth of expertise that I get to benefit from as well. And hopefully I can share a thing or two with them as well.
So for the audience members that don't know, Dr. Ashtari is a TPA Board of Trustees member, but could you give the audience a little bit of background as to what your practice actually is?
Yeah, so I work for the University of Texas Health Science Center at Houston, where I am an associate professor and a clinical and forensic psychologist within an inpatient psychiatric hospital, the John S. Dunn Behavioral Sciences Center. I'm also newly appointed for the director for the PsyD degree program in the new School of Behavioral Health Sciences at UT Health. So I've been there for almost 10 years.
I've heard the term pracademic to kind of describe individuals who are licensed to practice and are also in academia, right, doing research. When you hear the term pracademic, what is elicited in your mind?
Yeah, that's interesting. It's almost like a clinically oriented academic, right? And so I've never actually heard that term, but I like it. I think that's really cute. I think of a practicing clinical provider who's also engaged in the academic arena or in an academic setting. I'm in academic medicine, which typically means that I'm working alongside medical healthcare providers, psychiatrists, fellow psychologists, and various other disciplines that are represented, which is really nice. I also really like working in that setting because I can do a little bit of everything. I can teach and train, I can do patient care, I can engage in administrative tasks, research, and there's a lot of great collaborators within my system as well as within TPA where I can work together on different projects and collaborate.
I think there's a kind of myth out there that organizations like TPA, that exist, are mostly geared towards practicing private practice people or individuals who solely work in a hospital. So individuals who are licensed, who are practical in their nature, in their application of psychological concepts. To those individuals who are either solely academic or who hold the myth that TPA is solely for the licensees, what do you tell them?
Yeah, that's such an interesting myth because I've heard it too, what is TPA going to do for me? Even the hefty researchers, the highly funded NIH-funded researchers like to tell me that. And I'll be honest with you, what can TPA do for you? I mean, the profession, you're still a psychologist. And the profession will not have adequate representation, right, without our input. And so TPA is one of the biggest advocates for the integrity of our field, the ongoing advocacy that's necessary to make sure that licensed psychologists in Texas have laws and rules that actually benefit the community, the public, right, as well as our profession is so important. For me, I have had some academicians as colleagues who've told me, like, I don't need to join TPA, like that's not for me. And we have a conversation around, well, have you heard about this new legislation, or have you heard about that new board rule that was passed? Like, did you know that you could have had a say in that? Well, no. Well, yeah, that's what TPA does. That's one thing that TPA does. The other thing that I always mention is, like, TPA is a great venue, the annual conference at least, is a great venue to present your research and disseminate the work that you're doing so that other providers, psychologists, and academicians can also learn from you. And you can gain a network as well. I think for me, I think what's also helpful and important is to think about, like, promotion through the ranks of assistant to associate to full professorship, and how you need to have a network of people who know you and know of your work, who don't necessarily work within your department, to either evaluate your promotion potential and or write you letters of recommendation for promotion depending on your system's procedures. And so this is a great venue for meeting those people and learning from each other, connecting and finding your future research collaborators.
All right. Well, thank you very much, Dr. Ashtari. See you next time.
Thank you.